Hi, Dr. Dave Webster again. This letter is addressed to Cancer Care Ontario and specifically to Dr. Julian Dobranowski, who is the person who's the head of the section in Cancer Care Ontario that is continuing to assess the roles of possible roles of PET scanning in Ontario patients, not just for cancer patients, but for all patients. The specific topic of this video is regarding Cancer Care Ontario's support of the PET breast cancer trial. This PET breast cancer trial, I believe, demonstrates better than any of the issues that have come to light over the years about how the government has handled and introduced PET, demonstrates the lengths to which the government is prepared to go to delay and block access of patients to standard of care treatment or investigation methods around the world. That has become, PET scanning has become the standard of care of investigation management of cancer patients and other patients. Yet Cancer Care Ontario has supported a process which has led to the Ontario government putting patients in the most restricted access position in the world to PET scanning. So the details about the PET breast trials are on my website, and I refer you to them. But specifically, Dr. Dobranowski, I would like you or someone from Cancer Care Ontario to please explain Cancer Care Ontario's support of the following. Firstly, the breast PET cancer trial was deliberately designed to fail, as you know. The PET scanner was not physically capable of detecting the cancers they were supposedly looking for. And you will be well aware that ethical design of experiments on patients absolutely is clear that there should be some theoretical benefit to the patient or patients with similar situations. So I would like the Cancer Care Ontario to use the PET breast cancer trial to demonstrate why they support this trial and as an example of sound ethical research proposal on patients in this province. Secondly, who was excluded, every trial has patients excluded from it, and specifically this trial excluded the very patients that acknowledged world experts in PET had decided already was a potential appropriate use for a PET scan. That is, for looking for the possibility of recurrent disease. Women we know they have cancer and they're concerned that there might be some recurrence, and so this can be a potential use for PET. And yet, these women were deliberately excluded from this trial. So if the trials really are supposed to be about, as the government advertises, about trying to determine what is an appropriate access reason for PET, then please explain Cancer Care Ontario's support of an experiment that was not an appropriate reason to get a PET scan, and then deliberately excluded the very patients that the world beyond the borders of the Ontario Ministry of Health understood was a potential benefit for these patients or potential use. During this test, when you have this test, there is an exposure to a non-trivial amount of radiation. It could be, say, 400 chest x-rays worth of radiation exposure. Sounds like a lot of radiation. It's not actually that much radiation. A chest x-ray has a very low radiation exposure per chest x-ray, and for anyone who has the appropriate medical indication, you certainly should have this PET scan, or if it's indicated, or other medical diagnostic tests that have radiation associated with them. Certainly done properly, the risks of these tests are far, far less than the potential benefits of these tests when the test is done for proper reasons, which was, of course, not the case here. So these women were exposed to this radiation when the test was not indicated. I mean, this is well understood. It was physically impossible for the camera to do so. So I would like Dr. Dobranowski, you or someone from Cancer Care Ontario, to please explain to the women that took part in this trial why Cancer Care Ontario does support this test and similar experiments on cancer patients to try and supposedly determine the most appropriate access, reasons to have access to a PET scan. And of course, that it follows from this radiation exposure, that the unnecessary radiation exposure, that when someone is running a trial on cancer patients, it's also very clear in ethical human research design that when it becomes obvious that the test is failing, as it was obvious early on in the data since it had to fail, and that was expected, or that if there's undue or unnecessary risk to a patient, such as radiation exposure, in this case the test couldn't was almost impossible for the test to be useful for this patient. And finally, that there's a better alternative, which was already known, and that was the case as well. The experiment on these patients is discontinued. It's something called equipotential. So the test wasn't discontinued, the experiment. 300 women or so were put through this trial and exposed to this radiation unnecessarily. So again, Dr. Dobranowski, you or someone on behalf of Cancer Care Ontario, I think, should explain to these women why Cancer Care Ontario supported this trial. Finally, the very basis of this trial and the way it was evaluated was with evidence-based medicine. And as you and I have discussed before, there is no scientific basis or validity to the use of this test. It has not been validated. Evidence-based medicine approaches that the Cancer Care Ontario is continuing to use to evaluate this technology and other technologies. There is no scientific validity to the basis of this to assess, for example, PET's role in cancer patients, or any patients for that matter. Yet Cancer Care Ontario clearly endorses and supports and intends to continue to use an evidence-based approach to analyze the role of PET and other cancer-related diagnostic procedures and treatments. So again, Dr. Dobranowski, please explain to these patients why Cancer Care Ontario supports the use of a scientifically invalid tool, a tool which has taken cancer patients to the last place in the world when it comes to access to what has become the standard of care and management of their disease, and that is most cancer patients' disease, and that would be PET scanning. So, Dr. Dobranowski, in closing, are you prepared, or someone from Cancer Care Ontario, please, I would like you to stand up. Are you prepared to stand up and speak directly to the women that took part in this trial and explain to them why Cancer Care Ontario would support a trial which so outraged the provincial and national community in Canada, who are experts in nuclear medicine, as well as people with international expertise? Please explain so. Thanks.